Hey, it's Chris from Chris Beat Cancer, and today I've got a Q&A I want to answer. I get this question a lot, and I haven't ever really answered it on the blog or in a video. And this question is about surgery. Would I, if knowing what I know now, would I still have the surgery? I'm not really the kind of person that likes to go back and second guess my decisions and kind of what if. But I have learned a lot in the last almost 10 years about cancer. And so, yeah, I definitely have an opinion about surgery. So here it is. All right. First of all, you have to understand that cancer is not, that cancer is a systemic metabolic disease. The tumor, the lump, the bump, the tumor, that is not the real problem, okay? It is a problem, but it is really just a symptom of a much larger problem in the body. And so when you have surgery to remove a tumor, what you're doing is you are debulking your body. You're removing a lot of cancer cells. By the way, a 5 centimeter tumor, which is tiny, has about 1 billion cells in it, cancer cells. So, and 5 centimeters is about the smallest tumor size they can even detect. So by the time they figure out you have cancer, there's already 1 billion cancer cells that have congregated in a tumor. But here's the thing. Those same cells are also circulating throughout your body. They may be concentrated in a tumor, but they're not completely contained in that tumor. So removing a tumor does not cure you of cancer. And that is why they always recommend chemotherapy and surgery, or usually in most cases. So, because they know there are other cancer cells circulating in your blood and in your bone marrow. And by the way, we all have cancer cells in our bodies, okay? The immune system is designed to identify and eliminate those cells. So the difference between someone who's healthy and someone who has cancer, it's really a problem with their terrain, with what's going on in their body, with their immune system, detoxification pathways. They may be overloaded with toxins. They may be nutrient deficient, just starving for nutrition. So there's a lot of factors that play into a cancer developing in the body. So, okay, having said all that, surgery can be beneficial because it can remove a large mass of cancerous tumors. We know that 50% of cancers are cured by surgery. But that figure is actually misleading because that figure includes skin cancer, right? Includes moles and stuff like that. So you can't really compare a mole, a tiny mole, quote unquote, that's cancerous, to a golf ball sized tumor in your large intestine, which is what I had. So if you actually look at more serious stage 2, 3, and 4 tumors, those are not cured by surgery. And again, that's why they recommend chemotherapy and radiation, because they know the surgery is just removing a large mass of cancer cells, but the remaining cancer cells in your body will continue to reproduce and form new tumors unless you fix the underlying cause of your disease, which is a body that is nutrient deficient and overloaded with toxins. Now, here's something interesting that they found in 2004 at the John Wayne Cancer Center. They did a study on women with aggressive breast tumors, and the women whose tumors were biopsied before surgery compared to the women who did not have a needle biopsy. Okay, so one group had needle biopsy and then surgery a few weeks later. The other group did not have the biopsy, they just had the surgery to move the lump. The group that had the biopsy first had a 50% increase in malignancy. That means the cancer spreading after surgery. So that little tiny needle biopsy caused what they call seeding, which is where you poke a tumor, cancer cells spill out and they spread around in the surrounding tissues. And that can cause the tumor to spread, okay? Because when they come to take the tumor out, well, they're taking the tumor, but they're not taking out those cells that had spread after the biopsy. Now, the same thing can happen with surgery, with a major surgery. Your body's response to heal that surgery is actually like cancer fuel, because your body secretes all these growth hormones to heal itself after a major surgery, and those growth hormones are cancer cell fuel. So On one hand, surgery can be beneficial because you're removing a tumor and getting a big bulk of cancer cells out of your body. But on the other hand, it can also cause the cancer to spread what's left. So the thing is, if you want to have surgery, if it makes you feel better psychologically and emotionally to get a big lump out of your body, then go ahead and do it. But do not make any mistake, or don't kid yourself and think that it's not going to come back. That may just give you a jump start. You have to radically change your diet and lifestyle in order to give your body all of the fuel and firepower that it needs to heal cancer and stay cancer free. So again, surgery can be helpful, but you can't rely on it. Now, knowing what I know now, would I have had surgery again? Probably not. What I would have done, I imagine, well, let's just say a cancer came back. What I would do is I would take 30 to 90 days, radically change my diet and lifestyle and monitor the progress, monitor my blood work and have a few scans along the way and see if what I was doing is working. And the amazing thing is that people that actually do that don't panic, that don't get rushed into surgery and chemo and radiation, and actually step back and look at their life and make radical changes. They change their diet to a vegan diet. They start exercising. They forgive people, and they remove all stress and negativity and negative emotions from their life. That's when amazing healing starts happening. And I mean, I can't even begin to tell you how many stories and people I've met that's exactly what they did. Didn't have surgery, didn't remove a tumor. They just radically changed their diet and lifestyle, and their body healed. And so remember, you're in control, okay? This is your life. If you have cancer, you do not have to have surgery if you don't want to, okay? It is your life. But again, don't put your head in the sand. Don't kid yourself and think, oh, everything's going to be fine. You have to take massive action and change your life, okay? And you have to monitor your progress because you need to know if what you're doing is working. Right? The cancer's been growing a long time, even if they tell you, oh, this is an aggressive cancer or whatever. Typically, it's been growing a long time. Waiting a month to 3 months is not going to make much difference, usually, especially if you're radically changing your diet. In my experience and from all the people I've talked to, the worst case for people that do that is that nothing happens, right? The tumor doesn't get any bigger. It doesn't shrink, doesn't get any bigger. It just remains stable. That's typically the worst case for people that really go after it and change everything. People that don't change much, well, the tumor may keep growing. But the best case is that it starts to shrink, their blood work improves, and they see, oh, this is working. I'm just going to keep doing this. And then over time, the tumor shrinks and shrinks and shrinks, and then eventually it's gone. So again, it's your choice, but it's good to have all the information. It's good to know the risk with surgery is that the shock and trauma that it causes your body can actually promote the growth of whatever cancer cells are there, promote their growth. And but at the same time, it can give you a jump start. So I'm glad I had the surgery when I did. At the time I didn't know anything, and I was trusting God to lead me in that time of my life. Of course, I still am today, but He led me through that. The industry rushed me into surgery, and which they do with everyone. But I'm just glad that I had some divine intervention and was able to realize that I didn't need to poison myself or let myself be irradiated in some attempt to cure cancer with poison and radiation, which doesn't work. So anyhow, I hope that answers your question. I feel like it did. I've been talking for about 9 minutes. So anyway, feel free to subscribe to my blog. Yeah, it's at chrisbeatcancer.com. I've got all kinds of really awesome articles on there about nutrition and natural therapies and cancer prevention and healing cancer. And there's a bunch of survivor stories on there. People just like me. So the blog it's my blog, but it's not all about me. It's really about just sharing information about health and healing. And subscribe to my YouTube channel and to stay up to date on my latest videos. I'm trying this year to post more videos and be better about it. So anyway, thanks for watching.